The whole arrest procedure was very demeaning. I was terrified. Nobody cared if I was terrified. I was treated like a horrible, horrible criminal. And here I was, a 52-year-old grandmother of 5, soon to be 7.
People like Sheila, who struggle with a mental illness, all too often end up under the care of a warden instead of a doctor. And a prison cell is a far cry from a doctor's office.
I was treated like a horrible, horrible criminal. Nobody cared about what was going on in here and in here. Nobody cared. I was just treated, you know, handcuffed, fingerprinted, thrown in a paper gown, thrown down on a slab.
Sheila also knows what it's like to be on the receiving end of abuse from other prisoners.
Well, of course, then you get harassed and they want you to come out, and we had to go out and eat, and I smelled this hot dog and it smelled rotten, and I commented on it, and one of the other girls climbed over the table and she was going to attack me for complaining about the food. The whole thing was just like, right now I can feel it inside. It was so scary. It was so scary.
With an innovative program called Jail Diversion in Oakland County, people suffering from a mental illness who commit misdemeanors like disorderly conduct can avoid Sheila's fate if they agree to instead receive treatment for their mental health issues.
You know, our criminal justice system and our jails aren't set up, designed, or equipped to really provide treatment for individuals once they're incarcerated. Some folks who commit serious, crimes need to be incarcerated, and we know that. But for a lot of folks who are committing nonviolent misdemeanor offenses, statistics and my experience has showed that they're much better treated, and the prognosis is much better if we can get them treatment in the community as opposed to in the jail.
It is a wonderful program because, unfortunately, too many people who have mental illness end up in conflict with the legal system and end up in jail rather than in treatment. And the appropriate treatment for mental illness is not incarceration. The appropriate treatment for mental illness is appropriate treatment, not punishment. And obviously incarceration is punishment. That we have to understand that illnesses that affect the brain can affect behavior. Illnesses that affect the brain, which mental illnesses do, can interfere with judgment. Judgment, the ability to understand what's right and wrong, the ability to control one's impulses, depend on this brain working well. And when we have mental illness, parts of our brain may not be working well. So then people are capable of engaging in behaviors that they would never, ever engage in if they didn't have that mental illness.
The benefits of jail diversion are many. For starters, it promises to reduce nuisance calls for police departments.
We're going to make sure that this is a program that is helpful to officers, because a lot of these folks that we're diverting, the officer won't be seeing that person sort of cycle through the system on a repeated basis. So they won't be back at that street corner or the party store creating a disturbance. If we can get them plugged into some treatment, we can really sort of cut off that behavior that leads to those crimes.
Jail diversion will also help reduce the prisoner population in Michigan's jails by treating the underlying root cause of criminal behavior. Former Oakland County Prosecutor Deborah Carley says the benefits are obvious.
It will reduce the caseload, hopefully somewhat. That will help in the court, it will help with prosecutors. But most importantly, it's actually bringing people into the justice system who should be there, who need to be there, who need punishment, who need rehabilitation services that population is not subject to. The mental health population needs different services than what the jail provides, what the criminal justice system provides. And we need to focus all our resources on criminal defendants and those who actually need jail services, prison services.
Easter seals always amazes me at how we keep kind of stretching the boundary of what traditionally people think of Easter seals as being. It's exciting to be a part of some of these cutting-edge kind of programs, and jail diversion is definitely one of those.
They say an ounce of prevention is worth a pound of cure. And for Sheila, being out of jail means that she is around for her children and grandchildren. What better form of treatment can there be?
I'm just so happy. I love it. It just, brings these are tears of joy. The other tears you saw were not. These are tears of joy because that's just what they bring me. And I'm just really, really happy now.